You're listening to the Doctor Is In podcast, brought to you by MartinClinic.com. During the episode, the doctors share a lot of information. As awesome as the info may be, it is not intended to diagnose, cure, treat, or prevent any disease. It's strictly for informational purposes.
Hello, I'm Dr. Martin Jr.
I'm Dr. Martin Sr.
And this is the Doctors In podcast, and this is episode 194. And today we want to continue our discussion from the last episode, which we titled The 4 Culprits of Heart Disease. And in that podcast, if you haven't had a chance to listen to it, I strongly suggest you go back and listen to it, because in that episode, we laid out the 4 culprits that indicate future heart problems more than cholesterol ever did or ever will. Because, as we mentioned in the last episode, 75% of people that have a heart attack or more have normal cholesterol levels. Cholesterol is a terrible indicator of heart disease. We've said this in the past, but blaming cholesterol for a heart attack is like blaming a fireman for fires. Just because a fireman is at the scene of every fire does not mean that the fireman is the cause of that fire. Cholesterol is involved. It's such an important part of your normal biochemistry that your body makes it on its own, but it doesn't mean it's causing anything. And I think research has shown that, especially nowadays, research has come a long way. For years, that whole aspect of research really was bought and paid for. It makes it sound like conspiracy theories, doesn't it? But when the editor of the New England Journal of Medicine himself says don't trust most data or most studies, most of them are fake, it tells you.
Yeah, because they're sponsored, right?
Agenda-based.
Yeah.
Right?
You know,
a lot of research.
Find anything out.
And that's exactly what you just said. What you just said is true. You can get science to say whatever you want it to say and publish your results. Now, I've long said this before. I don't think we've talked about this on an episode, but I'm a firm believer that all research should be published, whether or not it showed your point or didn't. Because, again, if it didn't work out well, then other people should see that as well, because then they can start from, they know where to start. It's not a bad idea to have everything there, but it doesn't matter. Science, for a lot of science is bought and paid for, especially when it came to cholesterol medication. A lot of studies showing it was good for you. Then all these people started getting sore and diabetes and all these different things. Ton of side effects. Then research coming out saying, maybe it's not the best indicator of heart disease. Then maybe it's a terrible indicator of heart disease. Yeah. But it doesn't matter. It's still prescribed. If you are over 45-ish and you go to your doctor and you get a blood test and it comes back you got elevated cholesterol, they will talk to you about statin drugs. That's a fact.
Yeah.
It's still in the standard of care today.
Yeah, and you think of it nutritionally. I have to deal with it every day in a clinical setting, is that when I tell people to, for example, to eat more eggs because I want to get more protein in their diet. Well, doc, what about cholesterol? So it's in their craw, right? It's in people's craw. I mean, think of the marketing that had to take place for people to get
at
stuff
every level.
At every level, like from the physician to the nutritionist.
To the government eating guidelines.
When you think of it, like, it's just something that is almost beyond your imagination. But and this is, I mean, it's almost, you can almost believe it could never be true if this wasn't well documented. But that the government in England, United Kingdom, actually had a vote in the parliament as to whether to put cholesterol medication, listen to this, in the drinking water. Because they said, well, it's so preventative.
Can you imagine the boardroom at a cholesterol medication company sitting there listening or waiting for the results of the vote to put the drug that they make into water supply? I mean, that's the stuff you see in Bond movies, by the way.
Yeah.
Like, I remember that's the stuff that the Joker would do in Batman, would poison the water supply, but that's what they're doing.
But it was so pervasive that think about where you now, it didn't pass. Thank God. But can you imagine how, I hate to use the word duped, but do you imagine how unbelievable those marketing people were to get it through. People are still today scared to eat eggs.
Well, and
because of cholesterol. Like, ask them. Ask anybody on the street, and 9 out of 10 said, "Yeah, maybe I should cut my eggs down." Right?
Saturated fat.
It's the boogeyman.
The connotation, the images that come into your brain when you hear the word saturated fat has been planted there by lots of marketing, and now there's nothing you can do about that for a whole generation. The next generation hopefully doesn't get indoctrinated to think the same way.
You know, they're looking at
but
it.
But it doesn't matter. I mean, saturated fat, whenever you hear the word saturated fat, you think of artery clogging, because forever it's almost like that word was sponsored, right? The word saturated is sponsored by the company Artery Clogging. So it just, no matter what, saturated fat makes you think of artery clogging, right? Yeah. And it's terrible, but that's what happens. You got to go and buy
lean meat and lean this and lean that.
At the end of the day, here we are. We're recording this episode in July of 2019, and cholesterol is still discussed. It's still tested. It's still overprescribed anti-cholesterol lowering medication. It's insane. So in the last episode, we talked about the 4 culprits, and they were homocysteine, which is a toxic byproduct of amino acid metabolism. We talked about endothelial dysfunction. Your endothelium is a Teflon-like inner layer of your blood vessels. And when that's healthy, your blood vessels are healthy. When that's not healthy, things get stuck to the walls. That's when you start running into problems. Then we talked about nitric oxide, which is a gas molecule that you make in your body. And when that gas molecule is released, blood vessels dilate, they open up, and that allows better blood flow. Your heart, brain need it for health. And as we talked about in the last episode, so do your bones. And then the 4th thing we talked about was inflammation. And we talked about how CRP, which is C-reactive protein, is a marker of inflammation. So that was in the last episode. Today, what we want to talk about is 2 things. One, how do those 4 things become a problem? And then we'll end by talking about each of those 4 things, what you could take naturally to help with those 4 things. So we got a lot to go through today, but it's a good episode, and we're excited to share this information. And again, we've written a report that will be available, if it isn't already, very shortly on this. We wrote a heart health report. We did a fair amount of work.
Excellent report, by the way.
Yeah,
I give you credit. You know how to do reports.
And we wanted to, because we just kind of got frustrated with all this cholesterol talk.
Again, and we always come at it too, like from just, if you wonder where we're coming from, we're just coming from a practical, clinical application, right? Because sometimes people that are in research there's nothing wrong with that. They're doing their job, they're doing research. But we have real people on a daily basis for years and years. The Martin Clinic is established in 1911, and we've been going on for years and years. So we just have so much information that we see clinically, that these things are practical, and we're just trying to get, I always tell my patients, look, you pump my tires more than I pump your tires, because when you learn these things, and we're just trying to give you information, and you take that information, you make changes in your lifestyle and this and that to help yourself. I mean, that's what we're here for. We're just, our skin in the game is we want you to feel good. We want you to be healthy. We try and be healthy ourselves, right? And we're just trying to share what we see clinically. And we don't want you to go down these paths of these markers that we see, and
especially considering that statistically, heart disease is the number 1 killer.
Yeah,
so most people in North America, that's going to affect the most people.
Oh, absolutely.
Men and women, number 1 killer. All right, so let's talk about how these 4 culprits come to be, and then we'll deal with each one specifically again, as we mentioned, how to fight each and every one of them. Now, in a video that we did a while ago, we did a webinar on leaky gut. The reason why we talk so much about leaky gut is because if you reverse engineer all the top killers, and we're talking about heart disease, which is the top killer, but if you look at Alzheimer's, all these things, cancer, all the top killers, if you were to reverse engineer them, you would find along the way that inflammation is present in all disease. Inflammation, as we've mentioned before, is found in all disease. But inflammation doesn't just...
It's not a Houdini.
Yeah, it doesn't just magically show up.
No.
It doesn't, it's not, that's not how it works. So something has to cause that inflammation that then leads to these diseases. So what causes that? And you and I like to talk about the 80-20 rule. So if you took 80 people out of 100 and you said, and these 80 people had one of these top killers, they had heart disease, they had cancer or Alzheimer's, whatever it was, 80 out of the 100 would come from these three areas. So these three things affected or caused inflammation that eventually led to these diseases. Yeah. It's a long process. It can take a long time.
Yeah.
And what are those three things? First, which is what we talked about in that leaky gut webinar, is leaky gut syndrome. Yeah. And here's the thing. A majority of people that have leaky gut syndrome have no digestive symptoms whatsoever.
Yeah. That gets people because they still, as soon as you mention gut, they think, well, I don't have any digestive issues. I got a pretty good gut. But that's not what we're talking about. We're talking about what goes on in that gut.
Well, the gut is the connection between what you eat and how it gets into your system, your blood. I mean, you eat food, it gets broken down, it goes through the various stages of digestion. It gets broken down to its tiniest components, and then it gets absorbed through the intestinal tract into your blood, and your blood brings those nutrients throughout your body. Yeah, so the connection between a closed system, which is your blood, it's a closed system, to the food that you eat is your digestive tract. That's how important it is. And the health of your digestive tract, aside from allowing things to pass through, it's selective. Other things it doesn't let get through. Because there are things that get into your digestive system that shouldn't get in. Bacteria, candida, viruses, and even toxins, undigested food that doesn't get broken down fast enough. So your lining of your gut does not let those things pass. But when the lining of your gut gets irritated and it gets inflamed, and then all of a sudden those holes get bigger or not as selective, junk starts to pass through, and that's what leaky gut is. Yeah. And there's a lot of things that cause leaky gut, which is why if you get a chance, go to our website, martinclinic.com, go to the Start Here portion of everything, look at leaky gut, sign up, watch that free video, and we talk about all the causes, which is why a majority of people have some form of leaky gut syndrome, and a lot of people don't even know it. But leaky gut syndrome is a major cause of systemic inflammation. Yeah. Major cause of systemic inflammation.
Yeah. And it can attack your brain because of that. There's a huge connection. It can attack your heart. It can attack your blood vessels. It can attack, and so this is why we talk about it so much. People think, again, it's not digestion, although it could be.
It could be, for
and
sure.
You might not even be digesting properly, and you have no symptoms of you're not digesting properly.
But I would argue they probably do and don't even
they
realize
probably
it.
do, and they might not know it, right?
Because there's a lot of digestive symptoms that they wouldn't even know they have. Because I consider weak nails for a lot of people a digestive symptom.
Exactly, yeah.
Which sounds strange, but the health of your nails, the health of your hair, aside from thyroid, skin, a lot of these things are digestive symptoms, but they have nothing in their head to do with digestion. Yeah, so I that's why they would have the traditional digestive symptoms. Now, not everybody who has heart disease was caused by leaky gut, because there's we call them three seeds of disease. The second big cause is free radical damage.
Yeah, oxidative damage.
Oxidative damage, right? You use the analogy all the time. You cut an apple, leave it on the counter for a while, come back, it turns brown pretty quickly. Yeah. That is caused by oxygen. The very same thing that gives us life slowly rusts us out, slowly takes it away. Free radicals, it's funny, right? Because it's like you think of free radical damage. Free radicals are mutant molecules that are missing.
They're teenagers.
Yeah, they're missing a part, and they're going to go steal it from they're going to try to get that from everywhere in your body.
Kamikaze pilots.
They go in, they steal it, and they destroy whatever cell they take it from, and that's called free radical damage. That's what rusting is. So our cells are rusting out. Yeah. And we naturally make antioxidants that fight, and we take antioxidants that fight free radical damage.
And think of an antioxidant in the apple, in the apple analogy, put a little bit of lemon juice on one side of the apple. Cut an apple in half, put a little bit of lemon juice on the one side of it. What are you doing? What is lemon juice? Well, it's an antioxidant, right? It's got some vitamin C in it. And so what does it do? It protects that one side of the apple. Now, it'll still rust out, but it's not going to rust out very quickly. Not like the side that's not treated with antioxidants, right?
And all those things think of all the things that can cause an increase in free radical damage in the body, from chemicals, pollutions, toxins, stress, the environment that we live in. We are being bombarded by free radicals. If we don't have enough antioxidants to fight those things off, then we're rusting faster than we should. And this leads to inflammation. This leads to all of the 4 culprits that we talked about. Free radical damage can cause any of them. It can damage your endothelium. It causes inflammation. It affects your body's ability to make...
It ages the body.
That's right.
Prematurely ages at the cellular level.
So for a lot of people, chronic free radical damage led to inflammation that led to heart disease.
Yeah.
And the third seed of disease, so we've talked about leaky gut, we've talked about free radical damage. The third seed, which is the big one, which is high circulating insulin. Insulin, when it's out of whack, leads to a tremendous amount of inflammation, which leads to all the top killers. Now, we've talked a lot about insulin over the years because from a clinical standpoint, that's what we see all the time. We see people that have chronically elevated insulin levels. And here's the thing. When you start to have chronically elevated insulin levels, you are heading towards disease on a rocket ship.
Yeah.
It is it's like taking the bullet train over in Japan. You're on that train, you're heading in that direction fast. You got to get off that train. And that's what happens with high insulin, because high insulin in the body can affect the brain, right? A lot of people call Alzheimer's type 3 diabetes.
Yep.
It affects the liver. You start to pack a lot of fat around the liver. And once you start packing a lot of fat around the liver, you're going to be diabetic. You're going to have a lot of other issues as well.
And you're you're very toxic.
Very toxic.
Because that liver is such an important organ, right?
Then you start packing fat around the heart. Then it causes inflammation. It affects the way the blood vessels work. I mean, it's just bad news. So for a lot of people, the starting point for heart disease for them was either high circulating insulin, free radical damage, mix in a little bit of leaky gut, and then they're off. They're on that train to heart disease.
Perfect storm.
Yep, they're on that train. And the 4 culprits that we talked about are caused by those 3 things. Homocysteine, elevated homocysteine caused by... Let's talk about that for a second. So there are some big causes of elevated homocysteine, right? For example, somebody who is chronically low in vitamin B12 cannot clear homocysteine out of their body.
See how important B12 is?
That's why we talk so much about vitamin B12. And listen, we don't care if somebody is a vegetarian or somebody's a vegan, they better be making sure they're getting B12.
Yeah.
They better make an exception either for oysters or they better be taking some form of sublingual B12, because you're going to have a very difficult time getting rid of homocysteine. I don't care how you're eating. If you've got chronically low levels of B12, you're going to have a hard time getting rid of the homocysteine that's clogging up those blood vessels. That's the first thing.
Yep.
That's one. But you know that low thyroid hormones makes it difficult to get rid of homocysteine, allowing it to accumulate in blood vessels? When you think about what goes on there, think of all the reasons why somebody has low thyroid. High insulin is one. Think of high cortisol is another. Messed up estrogen, progesterone. We can go on and on.
Yeah, estrogen dominance. We see it all the time.
Heart disease, a lot of times for people, is a secondary issue that started after they started running into hormonal problems.
Yeah.
There are a lot of people that are listening to this episode that have long, chronic thyroid issues, and it's not the thyroid that's going to get them. It's the heart disease, and it's specifically the elevated homocysteine.
It's interesting, too, though, when you talk about heart disease, that it's much more prevalent today than it used to be in women. Like I remember in the 70s or whatever in school, they always talked about heart disease was almost like a man's disease. Like a woman might get a stroke, but later on in life. But now they're showing that women, it happens much earlier, and it's usually much more deadly in a woman. Like when they get a heart attack, like they often don't survive a heart attack. But when you think of the connection to hormones, when they were messed up with their estrogen, their thyroid wasn't working properly because we know
high stress cortisol.
You know, and then you add high stress cortisol, and you got a bad mixture for a woman, right? And as they, a lot of times they go through a lot of turbulence they get perimenopausal, that their body is changing, their hormones are shifting. Their doctor's saying their thyroid is normal, and yet they don't feel good. They don't have that energy. But look at how dangerous that can be, even for the blood vessels, and what it does with homocysteine, right? So anyway, there's a huge connection.
It's all connected. Mm-hmm. All right, so those are some of the big things that cause elevated homocysteine levels. Now let's look at the second thing, which is endothelial dysfunction. Let's go back to the 3 C's of disease that cause that. Again, free radical damage, probably the number one cause of endothelial damage, free radical damage. High circulating insulin, Same thing, damages the endothelium. And then the inflammation caused by chronic leaky gut, same thing. So now you have endothelial damage, and things start to accumulate. So you could see again.
And as you were saying, that Teflon isn't so slippery anymore, right? So when you think of what's happening inside that blood vessel, and one of the things that you and I have talked about, I don't know if it's on, it's probably quite a few podcasts ago, but we talked about again, it comes to that insulin, comes to the sugars, is glycation. And glycation is, the AGE of...
Whenever you say glycation, I think of, because it helps me think of it, is the caramel.
Yeah.
My wife would say caramel, because for some reason in the United States, where she's from, they cut out the second A. They just call it caramel.
Caramel.
But
caramel.
I think of caramel. I think of a caramelization, right?
Yeah.
Think of that. That's what's showing up. It's caramelizing you see it in the joints. Glycation causes joints to caramelize.
Yeah. And so blood vessels too.
Same thing. Surgeons go in there. Orthopedic surgeons are talking about going into these joints that have high glycation, and it looks like caramel in the joints. Yeah. You think a joint works well? You ever see sticky caramel, how it feels? Joints are not working properly.
That's why I think that's, and you and I talk about this, and I don't know if many other people talk about it, but we often talk about that high circulating insulin. And you get, with it goes back to food. It goes back to all the sugar that we eat. And it causes this glycation, and not only in the joints, but in the blood vessels. And this is where you get the endothelial. If you, again, reverse engineer endothelial, it causes free radicals, because even that.
Yes. That's why we have it as a triangle.
Yeah.
So if in the training that we did, that video, we talked about the 3 C's, and, high circulating insulin can lead to free radical damage and lead to leaky gut, and leaky gut can lead to the other ones, and it's all connected.
They're connected.
And usually if you have one, you have all three after a while, and that kind of it goes to that. So we get to endothelial dysfunction. Those 3 C's can lead to inflammation that causes that. The third one, nitric oxide. Well, how do you run into low nitric oxide? Well, age is one of them. Age is one.
Yeah.
But again, free radical damage free radicals, when they attack your cells, it significantly impacts your ability to make nitric oxide.
Yep.
So free radical damage is a big cause.
B12?
B12, low B12 again, big cause, right? So that's the 3 culprits. The fourth one, inflammation, that's what we've been talking about this whole time. So now you have homocysteine, you have endothelial dysfunction, you have nitric oxide, and you have inflammation. We're almost out of time. So let's talk about, in our opinion, probably the 3 best things you could take for those 4 culprits. We'll talk about that quickly. First and foremost, we love pine bark extract.
Yeah.
Right? We use pine bark extract in our Navitol. Pine bark extract is a powerful polyphenol. Most people, they don't know, they've never heard of polyphenols, but they've read studies or people post it on Facebook because they love these things. The health benefits of red wine or dark chocolate, they love that.
Yeah.
Well, the reason why people will say those things are healthy, or olive oil, for example, is because of the polyphenol content. Polyphenols are the compounds from plants that make their super powerful antioxidants. So people talk about the antioxidant effect of like dark chocolate, but it's from the polyphenols. And polyphenols are strong antioxidants, but not all polyphenols are created the same. There are a lot of different types of polyphenols, a lot of different families. So think of, like I always think of polyphenols, think of them like the mafia. There's a lot of families, and mafia is a generic term. Yeah. But there's a lot of families, and some families have way more power than the other families. So you have polyphenols, then you have a family of that called flavonols, and then in that family are what they are where pine bark comes from, which is OPCs. Yeah.
Which is probably the most powerful because of the broad spectrum that it has.
Yeah,
it has,
we call them super polyphenols.
Yeah. You name it, it's in there.
So pine bark is, you started using pine bark
back it's well over 30 years ago now.
When mom got sick, and that pine bark had a drastic effect on her health. And as the research is coming out on pine bark, it's an amazing antioxidant. It's a strong polyphenol, but a good antioxidant like a pine bark extract helps with homocysteine, helps boost nitric oxide. It helps with inflammation. I mean, it helps with
it helps the endothelia.
That's why we love pine bark.
Yeah,
we
sure
love
do.
pine bark
There's
extract.
probably nothing like it in terms of its overall ability to lower all those biomarkers or markers of cardiovascular.
We love pine bark extract for that. The second thing is B12, because when you are low in B12, you have a problem with all four culprits. You can't help it because you need B12 to clear out homocysteine. You need B12 for nitric oxide production, which then allows your blood vessels, your endothelium to stay healthy. So we love it. B12. And then the third one, which is fantastic as well, as DHA. Yeah. We love DHA is a type of omega-3 fatty acid. Yeah. We love DHA.
Yeah. Your body absolutely needs DHA. Your brain, for brain health.
Yeah, your brain, 60% fat, and it prefers DHA as its form of fuel.
We talk about it. Like we kind of funny because Mom's Italian, but we tell you, like, you're better off to be greasy, to be slidey, right? Yeah. And lots of olive oil and all these things that lubricate. And DHA, is there anything that lubricates your blood vessels and your brain better than DHA? I mean, it's fabulous oil.
So we like pine bark, B12, DHA. Is there anything else that you can? I think those three pretty much are the ones that we like for the four culprits. And again,
well, probably an indirect one, and I'll just say it on the side because you and I are so constantly talking about it, is vitamin D. And vitamin D, because the more they study it, the more they realize how it affects almost every area of your body, right?
You know what vitamin D, it always kind of reminds me of this. Do you remember the old Bugs Bunny cartoons, right, on Saturday morning? Yeah. And they had the Roadrunner and Wile E. Coyote, right?
Oh, yeah. I used to love those guys.
And Wile E. Coyote was always trying to catch the Roadrunner, but he never could,
Never could.
So he always, apparently the Roadrunner always ran down the same highway. So Wile E. would always built this massive contraption, right? And he would push a button and then 55 things would happen. Then eventually a boot would come across the highway and kick Wile E. But it never worked until the coyote came and looked at it and the boot hit him and knocked him off into down the Grand Canyon. But the reason I'm bringing this up is because if you look at all the pieces of that contraption, there's a lot. It's like Mousetrap, right? Yeah. There's a lot of pieces in it. But for a lot of things, if you go back from the boot to the gears to everything, it always goes back to vitamin D for a lot of things. Yeah. Vitamin D, like you said, it's not directly related, but indirectly it does so many things that you trace it back to vitamin D, and it's like, oh yeah, vitamin D helps with that. Yeah. Which is why we talk a lot about optimizing vitamin D levels. Yeah. And, the importance of vitamin D, of course, if you can sit out in the sun, that's the best. That's the best form of vitamin D. But you live where we live for 2/3 of the year.
Yeah, good luck with the sun.
Good luck, right? So that's why we talk a ton about vitamin D. Anyways, we covered a lot of information over the last 2 episodes, but we felt it was important because it all stemmed from reading an article about how heart attacks are making a comeback again in 40-year-olds. And it's like, all right, enough's enough. How much money has been spent on heart disease over the last 40, 50 years? How many?
Still number one.
And it's still the number one killer, and they're still talking about cholesterol, which is why we wrote this report, and we wanted to share that with you over the last 2 episodes. So again, thank you for listening, and have a great day.
You've reached the end of another Doctor is In podcast with your hosts, Dr. Martin Jr. and Sr. Be sure to catch our next episode, and thanks for listening.